Tell us about a time when you communicated something and the message was not received correctly.
Oh,
So you talk
um,
about closed loop communication and some lesson that taught you that.
oh yes, close communication. Oh, so this one. Um, and when I was doing my preceptorship in the, so they actually asked me to get a blood culture sample for a patient who's have a infection. I think she's in a urosepsis at that time. So my mistake with that one is that when I was doing the blood culture, because that was my first time to take a blood culture. Oh, sorry. The question is me be sending the message or them sending me a message. What was
The way that they asked this nurse was, tell us about a time when you communicated something that wasn't received, but the other way around is fine too.
Oh yeah,
Yeah.
because what I did on that situation, because they asked me to do a blood culture, and I was so excited to do the blood culture, and then the my nurse preceptor told me to wipe the blood culture with alcohol swab. So that's what I did, but I didn't know that I should use like a separate alcohol swab for both the aerobic bottle and the anaerobic bottle. So what I did is I swab it with only one alcohol swab, and then my nurse preceptor noticed me. What are you doing? You said I have to wipe it with alcohol swab. Yeah, but you have to wipe it individual with the individual alcohol swab. Oh, I'm so sorry. I didn't know that. So what I did is I corrected my action. I took a different alcohol swab again and re-swab it. But luckily, my nurse preceptor cut it right away, or else I have to draw the blood culture again, and that would be cumbersome for my patients. So I learned from this experience that uh, you have to make sure you communicate something to your nurse preceptor who is experienced who is experienced than you. So at that time, I know I was so excited to do things, but I should have cross checked with her. Like if she asked me something, do you mean that I have to swab it with one or two? I should have said that. So at that point, I that's a learning experience from me. So I always make sure every time I do something that I'm unsure of, I always ask questions, confirm, and for example, if I'm already done doing it, I will always close loop communication. I will always say, okay, I'm done taking the blood culture. I already sent it to the lab. So make sure that everything is on the same page.
Okay. Okay, perfect. And I love that you said the word closed loop communication, right? Next, I will do this. Is that correct? Especially, anytime there's a critical situation where you need to take a verbal order from a doctor, especially if it's about a medication, to always verify, I heard this medication in this amount. Is that correct? Yeah, closed loop communication is so important. So you can use this. You can also say that as you were listening to your preceptor, you also had the policy and the procedure in front of you. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.